Good afternoon, distinguished colleagues, Honorable Chair, and my dear conference colleagues. This is Dr. Moniruzzaman Mollah, working in a public medical college, and I served in the field of pediatrics for the last 25 years. Today, it is my great opportunity to meet you and share you with my study in the field level study on zinc deficiency is associated with early childhood anemia in rural Bangladesh, an observational study. We'll go through the presentation outline. First of all, in what context we are going to conduct this study. That is the background of the study and the research question and what methods we followed and what are the key findings, followed by conclusion and recommendation. Bangladesh. Bangladesh is a South Asian country. It is the 8th most populous country in the world. And it's a very small country and leading to its highly dense country in the world. And most of the people live in rural area. That is, every 2 in 3 people live in rural area. And every year, there are 3 million births take place. And most of the people lived in rural area. So my research takes place in the rural area, and under 5 population is around 20 million. So most of the people as lived in the rural area, and the rural area is lag behind in terms of infrastructure, service network, healthcare access, and that is why the rural children sit in a stage of health challenge in our country. That is why the under 5 mortality is high, though it was 170 in 1970s, but it reduced to 29. There is a great achievement, but still it is so high. And Bangladesh is a land of river. Bangladesh has 6 seasons. So there is a change of weather every year, 6 times. And there is a natural calamities like flood. So all these things causes repeated infection of the children, and there is in our country, the children usually raised and take care by the grandparents. So those are not scientifically sound. So they care their child with no food diversity, and sometimes they take care with carbohydrate and carbohydrate combination. All this makes protein energy malnutrition and micronutrient deficiency. And micronutrient deficiency is more than macronutrient deficiency. That causes a micronutrient deficiency is a public health challenge in Bangladesh. And if we have a look here, among the micronutrient deficiencies, zinc deficiency is the leading one. Around 50% of under 5 population suffering from zinc deficiency, whereas iron deficiency is around 10%. So zinc deficiency 5 times more than iron deficiency in our country. Besides, vitamin A, vitamin B12, vitamin D3, all exist or are prevailed in our country. If we have a look over the anemia situation, anemia, according to micronutrient survey, the anemia prevalence in 2013 was 33% national average, but with rural predominance, that is 37%. among the 37%, iron deficiency only explained 7%. That is the rest, 80% of the total anemia burden remain unexplored. So that is raised the questions how we can explore these 80% etiologically. Therefore, we formulate study. In one hand, there is a huge zinc deficiency. On the other hand, 80% of the anemia remain unexplained. That raise our question, research question, is zinc deficiency associated with childhood anemia in rural Bangladesh? An earlier study in the New Zealand, 2016, showed that zinc is a predictor of anemia. And we formulate this hypothesis for our study, and we set our objectives as to examine the link between zinc deficiency and childhood anemia, and to identify or explore anemia beyond iron deficiency and inherited hemoglobin disorder. And we design our study as a cross-sectional observational study, and we take 11 sub-districts from the rural areas of the northern Bangladesh, and 428 under 5 children enrolled for this study. And for analysis, we anemic children, and for zinc analysis, we analyze children in a subgroup method. And statistical analysis, that is this chi-square test, were used, and p-value less than 0.05 was considered significant. And comprehensive lab tests conducted. Those included complete blood count, ferritin, hemoglobin electrophoresis, vitamin B12, folic acid assay, and zinc assay. And process, we followed usually first anemia screening, then anemic group, again analysis for etiological exploration, and those who are remained unexplored or unexplained, those enrolled for zinc estimation. And zinc levels was less than 69 microgram per deciliter was considered as zinc deficiency. So we follow this flow chart. We applied this flow chart under 5 children, 428, and then we conducted CBC and hemoglobin test. Then we found less than 11 gram, that is anemic 263. With 263, we conduct ferritin assay, hemoglobin electrophoresis, and vitamin B12, and then we found 163. Then 163 was asked for zinc assay, and those who responded, that is 67, were analyzed for zinc assay, and finally we classify as iron deficiency anemia, inherited hemoglobin disorder, and zinc deficiency associated anemia, and others. Our socio-demographic character of our population was 52% less than 2 years, and 57% were male, and 84% mother or primary child giver was secondary enrollment or below level education, and monthly income was less than 165 USD per month among 64% family. So these are the typical picture of our rural society. And what about the result? What are the findings? Number 1, anemia prevalence. Our study get high anemia burden in our rural society when it 61% overall prevalence, and when we consider age, it was less 71% less than 71% below 2 years of age, and mostly mild or moderate. Number 2, etiology. Before zinc assay, we found 1/3 iron deficiency, 1/3 hemoglobin disorder, and almost nearly 1/3 became undifferentiated. This undifferentiated part were our study area, and when we zinc assay conducted, zinc deficiency explain around 1/4 of the total anemia burden. And when we conduct with low zinc level, high zinc level, and normal zinc level, then we found significance, statistically significant, and zinc status anemia significantly associated with low zinc level, and it was p-value is less than 0.001. When we again analyze the low zinc level, then low zinc level with anemia can occur independently or with combinedly. Independently, we found 55% case that indicate zinc deficiency alone is associated with anemia. Our study findings is also similar study findings is observed in India, China, and Guatemala. Those countries have zinc deficiency, prevalence of zinc deficiency is higher on the left side of the image, and anemia prevalence pattern is similar with the zinc deficiency. And all of the study indicate zinc deficiency is a strongly and significantly associated with anemia. The limitation of our study was cross-sectional design, and confidence sampling technique was followed, and during subgroup analysis, some children did not respond. The strength of the studies, it is so far the first of its kind in Bangladesh, and comprehensive lab tests were conducted, and our rural society is homogeneous. That is why it may reflect the total scenario of our country. So in conclusion, we can say anemia prevalence is strikingly high in rural Bangladesh, with peaking less than 2 years of age. And low serum zinc is significantly and independently associated with anemia. Therefore, zinc deficiency might be recognized as the leading factor of childhood anemia beyond iron deficiency anemia and inherited hemoglobin disorder. And the implication of this, what is the implication of this research? It is the basic or base research for our experimental study or interventional study. It will, zinc can be included in the anemia workup in the clinical level, and policy level, zinc is only added in the diarrhea management. But we can recommend zinc can be the part of anemia prevention strategy. And finally, in public health view, we can diversify food, and zinc can be supplemented to overall supplementation in the rural areas. And this study is also evidenced by the global other references. So finally, we can say zinc deficiency, a hidden driver of childhood anemia in rural Bangladesh. So together we can work and conduct research with zinc, and ultimately we can shift our policy and management level, thereby we increase child well-being and survival. Thank you very much.